Hello everyone, my name is Okubadejo. I'm a professor of neurology and a consultant neurologist at the Lagos University Teaching Hospital, Idiaraba, Lagos State, Nigeria. And it's my pleasure to talk to us today about Parkinson disease. Parkinson disease, also called PD or Parkinson's, is a medical condition that affects the brain. And the core issue is that over time there's a gradual loss of special subsets of nerves within the brain that control movement. And these subsets of neurons use a special chemical known as dopamine. And so as Parkinson's disease progresses, it's a result of loss of the dopamine, and this eventually causes slowness in movement in addition to other symptoms. Every year throughout the month of April, we commemorate Parkinson's disease, creating awareness about it. And we especially mark it on April 11th of every year. So this year on April 11 is World Parkinson's Day. There's a lot of interest about what causes Parkinson's disease. In general, we do not know what causes the disease, but we are quite aware that it is a combination of inherited risk and environmental exposures. About 5 to 10% of people with Parkinson's disease clearly have genetic inheritance. They inherit it from their parents, but the vast majority, we think that it's a combination of a risk that they've inherited and exposures to things in the environment, such as chemicals that are neurotoxins that can damage the brain. An example of such chemicals is paraquat, that is used as a pesticide in the farming industry. Who is affected by Parkinson's disease? Parkinson's disease does not respect age, gender, ethnicity, or geographic location. And so we say that anyone actually can develop Parkinson's disease, and that is one of the reasons why we should all be concerned about the disease. However, all over the world, we anticipate or estimate that about 10 million people are currently affected by Parkinson's disease. It's the fastest growing neurologic disorder, and the projection is that by 2040, about 20 million people worldwide will be affected by Parkinson's disease. We generally accept that 1%, that is 1 out of every 1,000 people above the age of 65 have Parkinson's disease in any given population. What that means is that as the population ages, as you have more people attaining the age of 65 and older, we're going to have many more people affected by Parkinson. There's also interest in recognizing the features of Parkinson's disease. In other words, what are the symptoms that people with Parkinson's disease can experience? And the most recognizable symptom of Parkinson's has to do with movement, and that is why we characterize it as a movement disorder. Most commonly, a person with Parkinson's will experience slowness in initiating movement, but also in carrying out movement. So for instance, difficulty rising from a low chair, difficulty turning in bed, difficulty with tasks like buttoning shirts, and even slowness while walking. The second common symptom is tremor. And tremor just refers to shaking. It's usually the shaking of a limb. It can be the arm, it can be the leg, but also the chin and the jaw can shake. People with Parkinson can also have stiffness of their joints. They can also experience, with time, difficulty walking and feeling as if their feet are stuck to the ground. However, it's important to emphasize that not only movement is affected by Parkinson, because dopamine also has other functions. So Parkinson can affect a person's sleep, such that they have dream enactment, they talk in their sleep, they act out their dreams, can also cause constipation, can cause changes in the mood such as anxiety and depression. It can also result in other complaints such as pain. And so it's important that we recognize that it's not just movement symptoms, but also symptoms unrelated to movement. The other important thing to recognize is that not everybody with Parkinson has the same set of features. They certainly have much in common, which is mainly the movement issues. But at any point in time, if you gather people with Parkinson's disease, their experiences of the severity and the spectrum of their symptoms will vary. Now, another important aspect of Parkinson's disease and understanding it is, how do we make a diagnosis? So the diagnosis of Parkinson's disease is usually made by a physician who's trained to recognize the features, and is usually a clinical diagnosis that does not require any additional tests. Often this physician is a neurologist, but other physicians can also make that diagnosis quite confidently if they've been well trained. In making a diagnosis, like I said, it is usually clinical, and the importance is to differentiate Parkinson's from things that mimic it. In certain circumstances where there's confusion as to what the clear diagnosis is, other tests like imaging and special imaging tests of the brain can be conducted to make a diagnosis. In treating Parkinson's, when a diagnosis has been made, it's a group effort. It requires the input of not just the managing physician or neurologist, but also other healthcare practitioners and specialists like physiotherapists, speech therapists, occupational therapists, nurses specializing in Parkinson's disease, and psychiatrists, together with patients themselves who are core participants in their care and their family members and caregivers. So this team-based approach typically would result in a better outcome because we take into consideration the preferences of the patient, and we also bring to bear the specialists and their expertise in the management of Parkinson's. There is no cure for Parkinson's. However, there are many treatments available that address the symptoms of the disease. So we often prescribe medication to increase the levels of the dopamine, and medication to also alleviate the non-movement associated symptoms of the disease. In addition, in advanced cases of Parkinson's, surgery known as deep brain stimulation can be offered where the facility is available to also further alleviate the symptoms. Having said that, there are other modalities of treatment that we apply, and one of these is physical therapy. We emphasize that exercise and physical therapy are really core to the treatment of Parkinson from early in the course of the disease through the entire course of the disease. Apart from offering treatment, we must all recognize the challenges that people with Parkinson's disease experience. And these challenges are related to stigma, are also related to the lack of understanding and misinformation that goes with a population that does not know what the disease is about. So one of the things I want to emphasize is that we all need to try and understand what is Parkinson's, what causes it, what we can do to support people with Parkinson's, and what efforts we can make to expand the awareness about Parkinson's disease. In terms of what we are doing locally as an institution to help to improve the outcomes of people with Parkinson's disease, we have a Youth Movement Disorders Clinic, which is the first movement disorder clinic in the whole of West Africa. We have been privileged to have partners such as the Farah Foundation, who provide levodopa-carbidopa, the mainstay treatment for Parkinson's disease, for patients who are not able to afford their medications, and we're very grateful to such partners. We're also partners in research with many leading research collaborations across the world. Most importantly, we're part of an effort known as the GP2, the Global Parkinson's Project, that is studying the genetics, understanding how people inherit Parkinson's disease. We're also part of an initiative called the PPMI, which is the Parkinson Progression Markers Initiative. It's funded by the Michael J. Fox Foundation for Parkinson's Research in the US, and is one of the leading research efforts to understand how Parkinson's progresses and to find markers within the tissues of people with Parkinson, blood, saliva, urine, and so forth, that can lead us to finding treatments that can slow the progression of Parkinson. And so we invite people who think they may have Parkinson to join us in this effort in leading to a cure for Parkinson's. In this month of April, our main message is this: for our policymakers, we need our policymakers to acknowledge the social, economic, and cultural impacts that Parkinson's disease has on those who have the disease. And we need individuals to also join the effort to promote awareness, especially social media enthusiasts, to join in this year's World Parkinson's Day by sharing the hashtag World Parkinson's Day, by also connecting on social media to spread the different social media messages that go with the day. Thank you very much for listening.